Hey, let's get started. Welcome, everybody. My name is Heather Bonome, and I'm the Director of Pharmacy with URAC. And welcome to an expert conversation with URAC on rare disease pharmacy care. I'm excited to host this conversation. I'm joined by two of our experts, two URAC pharmacy accreditation reviewers who are subject matter experts and have experience reviewing rare disease pharmacies. A few opening reminders just as we kick things off. We would love for you to introduce yourself in the chat. What organization are you from? Where are you located? Just to help us have a little bit of a better understanding of who all is on the webinar today. If you have any technical issues, you may message in the chat Lisa Silverman. That's Lisa Silverman, and she'll make sure to take care of anything you need. This webinar is being recorded, and we'll make sure to get a copy of the recording out to everybody by the end of the week. As I mentioned, we're going to utilize the chat there. So we'll utilize the chat for introductions. We'll also utilize the chat for any questions that you have. We're happy to answer questions along the way. We have another reviewer on the line who's going to be keeping an eye on the chat for us as well. And we can also answer any questions throughout our conversation. And we'll keep some time at the end for any additional questions to wrap up our time together today. This is a pretty quick webinar as far as URAC is concerned. So we're together for just about a half an hour today. So we're going to go ahead and jump right in. I am the facilitator for today. I'm going to kick things off, but then I'm going to have a conversation with our reviewers. As I mentioned, my name is Heather Bonome. I'm the Director of Pharmacy with URAC. I've been in this role for about 9 years now. And I get to lead the pharmacy accreditation practice at URAC. And that means that I work with and manage the team of pharmacy accreditation reviewers, two of whom we have with us today. And I'd like to allow Bruce and then Joe to introduce themselves to you.
All right. Thanks, Heather. Hello, everybody. I'm Bruce Carnes, part of the pharmacy review team. I report to Heather. I've been with URAC about 6.5 years now. Obviously part of the rare disease team, and I enjoy that very much. Look forward to hearing from you and your questions today.
Thanks, Bruce, and thanks, Heather, and hello to everybody. My name's Joe Moore. I'm a pharmacy reviewer with URAC. I've been with URAC for a little over 2.5 years, and like Bruce, I'm also part of the rare disease review team and excited today to have this conversation, share some information with you, and answer any questions you might have.
Perfect. Thanks, guys. So let's take a look at our agenda. As I mentioned, this is a quicker webinar, so just about a 30-minute conversation. So I want to spend most of our time in our discussion, but before we jump into that, I do feel like we want to just go through a few definitions to level set, and then spend just a little time talking about URAC's expertise in rare disease to set the stage for our discussion. And as I mentioned, we'll also wrap up with any questions that you all have before we finish our webinar today. So just 3 definitions that we want to review with the group before we kick off our discussion. And really fundamentally, what is a rare disease? A rare disease is a condition that affects fewer than, per the US definition, 200,000 people in the US. And then the EU has a slightly different definition, a condition that affects fewer than 1 in 2,000 people. And the need for rare disease definition really came about because we needed to establish which conditions would qualify for some new incentive programs. So it was an issue because rare diseases impacting so few people, there was a lack of incentive for drug companies to develop treatments. So back several decades ago in the 80s, the Orphan Drug Act was passed to create these financial incentives to encourage new drug development for rare diseases. And in the decades since 1983, when the Orphan Drug Act was created, more than 3,000 products have been designated as orphan drugs to treat orphan diseases. You know, we talk about rare diseases being rare, which obviously they are, and there are more than 10,000 known rare diseases that end up affecting about 1 in 10 people in the US. So when we think about, well, the individual rare diseases are rare, it's actually not rare to have a rare disease. And there's a real need for making sure that patients who are dealing with rare diseases have the appropriate patient care that they need. Following on that, what is an orphan drug? Next slide. Right, so it's pretty straightforward. Per the Orphan Drug Act, this is a drug that has a special status because it treats a rare disease or condition. And what is a rare disease pharmacy? Also more straightforward. It's a pharmacy that clinically manages patients taking an orphan drug. So those are our definitions. So why is URAC talking about rare diseases and orphan drugs? And this really goes back to our expertise in specialty pharmacy. So while URAC accredits healthcare organizations across the healthcare industry, we are widely known as a leader or the gold standard in specialty pharmacy accreditation. We've been doing specialty pharmacy accreditation since 2008. We have more than, can we go to the next slide, please? We have more than 500 specialty pharmacies accredited, and our standards have evolved to version 5.0. So we've been doing this for quite a while. And we've been widely recognized by payers and manufacturers for the value that accreditation brings, and it's often required for network participation. This recognition really gives us a unique view of the industry, and it introduces us to a lot of key players in pharmacy, specifically in specialty pharmacy. And more than 5 years ago, one of our accredited pharmacies introduced URAC to leadership at NORD, the National Organization for Rare Diseases. And that gave us an opportunity to learn more about the growth in orphan drug approvals and the additional clinical services that patients taking these orphan drugs really need, beyond the clinical services that were recognized as the normal practice in specialty pharmacy and beyond the requirements of our current specialty pharmacy accreditation. So that led us to develop our recognition program in rare disease. And this was launched in 2020. And it really recognizes that pharmacist's clinical role or the critical role in the clinical care that is provided to the management of individuals living with rare disease. And it elevates those specialty pharmacies that have a focus on patients who are dealing with these rare diseases. To date, we have 19 organizations. They're all currently specialty pharmacy accredited that have also achieved the certification in rare disease. And we've gone through a couple of revisions as well, as we're on version 3 of that accreditation, that certification program. So the rare disease standards build upon the specialty pharmacy standards, which is why specialty pharmacy accreditation is a prerequisite for seeking the rare disease. And then specifically when we think about the patient management focus area, so those initial assessments, reassessments, the education given to patients, all of the fundamental specialty pharmacy elements are so important. And in addition, what additional do we need to consider for a rare disease patient when we're conducting an initial assessment or a reassessment? Or what additional education needs to be provided? And I'm sure some of the specific aspects of these requirements are going to come out in the discussion with our experts today. Just wanted to show a snapshot of what's included in these standards. And with that, I think we can transition to our discussion with Bruce and Joe. So both of you have been reviewing specialty pharmacy for the specialty pharmacy accreditation program, as well as the rare disease certification for a while now. So can you tell me about some of the pharmacies you have reviewed for rare disease, and what are the different models that you've seen? And Joe, if you could go first, and then we can hear from Bruce.
Yeah, of course. So certainly in my time, I've seen a few different models of rare disease pharmacies. I think one that I've seen has been the rare disease pharmacy that's part of an academic medical center, or maybe it's part of another larger health system. Of course, those have the benefit of being maybe embedded in the clinics, or at least very closely associated with clinics for having access to more documentation of patients and their care. But I've also seen models of rare diseases that are part of closed door specialty pharmacies that provide services to patients in all 50 states, but include on their formulary orphan drugs and treatments for rare diseases.
Awesome.
Yeah,
Thank you. Bruce?
yeah, and within that, we have different size pharmacies, right? We have the larger, primarily rare disease pharmacies, and oftentimes you'll see those with multiple teams, kind of based on drug or therapy. Sometimes that's driven by the unique requirements of manufacturers, clinics, hubs. So that requires a lot of specialization for those larger groups. And we also see smaller pharmacies. Maybe these are primarily specialty pharmacies first, and they're branching into different rare diseases. And oftentimes we'll see that as kind of a different model where they have a single clinical team and they train everyone to meet those few rare diseases that they're taking care of. So we do see a little bit of everything.
Mm-hmm. That's similar to our specialty pharmacy accreditation. We see a lot of different models there, so that makes sense. Joe, can you talk a bit about what differentiates pharmacies who are taking care of rare disease patients from a more, I'm going to use air quotes here, traditional specialty pharmacy practice?
Yeah, definitely. And I think it builds nicely off of what Bruce was just saying. I think the first thing that jumps out at me are these dedicated teams to take care of rare disease patients. And there could be overlap. So if you are a clinician, you might be working with more than one rare disease or with more than one orphan drug. But for each rare disease or for each orphan drug that the pharmacy is dispensing, there's going to be a dedicated care team. And I think that that care team is often made up of both clinical and non-clinical personnel, but these are really the experts in these drugs or in these disease states. I think along with that, I also see increased trainings throughout these organizations. And these are clinical trainings, certainly, to make sure that the clinicians on those teams are up to date on everything that has to do with that caring for those patients. But I think it also has to do with non-clinical trainings. And this could be communicating with patients. It can be trainings on awareness, whether that's cultural awareness or empathy for patients in their situation as they're dealing with their rare disease. And I think probably the last thing that really comes to mind is maybe a more robust benefits investigation team. And this is going to build off of a close relationship that the pharmacy has with the manufacturer. But that benefits investigation team really is going to be helpful in providing access to the medications for the patients and even being able to try and locate financial assistance for those patients. As we've seen, and Bruce would I'm sure have the same opinion, that these medications often the largest barrier to them is cost. And so having this benefits investigation team that can try and find resources for patients is so key in helping them with their experience and in their journey.
Mhm. I think you're right, especially because, again, there are so few patients taking these medications. It's not maybe necessarily known what is the pathway for this medication, right? It's not, right? So making sure that there's a lot of there are a lot of resources available for that for sure.
Yeah, and I think that's also just working closely with the manufacturer. And so
Yeah.
having some liaison on your team or somebody that's able to have that communication with them to leverage that support that the manufacturer can offer.
Mhm. Excellent. Thank you.
Mhm.
Bruce, can you talk about what has impressed you most about the pharmacies that you've reviewed for the rare disease certification?
Yeah, I think the most successful pharmacies that we see are those that really have the willingness, both management and their clinical teams to contribute the time, effort, staff, and money to effectively manage, a population that may or may not fit into the traditional pharmacy model. Obviously, these are not volume-based therapies, so they do fall outside of what pharmacies are normally used to taking care of. It's not just adding a drug or a therapy, it's an entirely different model. And lastly, I think one of the most important things that I do see in a successful organization is the understanding and the empathy of the staff, um, to really learn about their patients, and we'll talk about this later, learn about their journey, their barriers. Um, that kind of separates the really good organizations, I think.
Mhm. Yeah. Yeah. When you talk about the journey, I remember hearing, and I think it was our friends at Nords that were sharing this, that on average, a patient who is diagnosed with a rare disease, often it takes them about 10 years to get that diagnosis, right? It's not something that your clinician is seeing every day. And it's often, a process of elimination when identifying the appropriate diagnosis. So it really is, unfortunately, is often a really long journey for these patients, and that's just to get their diagnosis. And then we need to think, okay, great, now we've got a diagnosis. Is there a therapy? Are there multiple therapies? What is the appropriate therapy? So there's just so much, and it's not just the patient, it's also their caregivers, their providers, their family, etc. So our standards do emphasize understanding the patient's journey. And so, Joe, can you talk a bit about what you've seen and how your experiences help you understand the importance of that patient journey?
Yeah, absolutely. I was nodding along as you were talking there, Heather, because that patient journey is so important. And the patient journey is really everything that the patient has experienced up until that diagnosis. But it's not just what that was, it's the patient's experience with it. And you talked about it, Heather, 5 to 10 years to get the accurate diagnosis for your rare disease. And in that time, think about everything patients are dealing with. I've heard it referred to as the rare disease patient odyssey because there's a lot of twists, turns, there's false starts, there's misdiagnoses, there's treatments for symptoms, but not an actual cure. There's online research where the patient themselves is trying to find some community somewhere where they can find people that have dealt with what they've dealt with, so maybe that'll give them some hope. And all of that culminates with the diagnosis. And what we're starting to see is how that patient journey, documenting that patient journey and assessing what that patient's experienced, that actually has a really strong impact on the patient's own healthcare experience. And so by understanding that journey, it allows you as a clinician or as a dedicated team to engage the patient in a conversation or in a discussion that might help you discover some unmet needs. And those unmet needs we refer to them as barriers, but they could be anything that patient's experienced both prior to the diagnosis, but that also may be an issue continuing on. So understanding the journey is important for not just understanding where the patient's coming from, but also helping them understand where they're going to, and trying to be as predictive as you can to try and meet those unmet needs or see what those barriers might be.
Hmm. Yeah, absolutely. Absolutely. Bruce, you had an opportunity to attend NORD, the National Organization of Rare Diseases, annual meeting last fall. Can you talk a
Yep.
bit about some of the topics or themes in rare disease that you heard about there?
Sure. And really, the most common theme, both today and at NORD, is just what Joe talked about, patient journey. Uh, just the caregiver stories that were told, really heart-wrenching to hear what they go through, and the frustration of being unheard, as we mentioned, oftentimes misdiagnosed. And then conversely, the feeling of total relief after finding that right clinician, that right diagnosis that gives them hope and a plan going forward. The stories were really moving. Secondly, I think barriers to access was also a big deal. We also touched on that. There's so many issues with these rare diseases. Sometimes they travel hours or even flights to get to the clinic they need to go to get the diagnosis they need. Maybe they're unable to work. They have a caregiver, or they have a patient that they're taking care of that they can no longer work. The insurance issues we touched on, prior auths, copays. There's just so much involved, so many barriers for these patients. Lastly, I heard really on the importance of community, what it means to those families. Rare disease, the nature of rare disease means it's highly unlikely that they have friends or family that can relate to what they're going through. So when they do have the opportunity to connect through these support groups that they get in touch with, it's really a huge relief. They don't feel that sense of being alone. And again, so many stories around that. So really, if anyone has that opportunity, I would really encourage you to attend NORD. It ties that all together. We all learn about these things, but when you hear the patients talk about it, it really brings it home. So if you have that opportunity, I would really encourage you to attend next year.
And I'm glad you brought that up, Bruce. that community, that connection, right? That's part of what we've incorporated into the rare disease standards. So when we talk about building upon the specialty pharmacy standards and the education that's providing, how can you educate this patient to make sure that they are aware of different resources? And that might be an online resource, that might be a portal, that might be a community or an online community support group.
Yep.
Can either of you talk about, how you've seen that education play out in the organizations that you've reviewed?
Just for me, just kind of what you talked about, a lot of these manufacturers have support groups tied to theirs. And so that's available through the manufacturers. And that's, getting that information to the patients immediately and getting that sense of community built up with the families. It's hugely important.
Yeah, and I agree with that, Bruce. And they're all rare diseases, but they present differently. Some present really mildly, some present really severely. There's differences with what part of your life you'll get these at. So some rare diseases are going to be more prevalent in a pediatric population or an adult. And so I think you're right. Like having accurate information is the first barrier often when you are experiencing symptoms or you're the caregiver for somebody who's experiencing symptoms, just trying to find out what is this disease, where can I find help with it, who else has something like this. And so I agree with Bruce. The manufacturer is a great place to start. Once a patient can get that diagnosis or once a patient presents to your pharmacy looking for information, being able to give them that accurate, clear information and connect them with the community, that's like Bruce said, leads to such relief for the patient, at least to now finally feel heard, seen, understood.
Got it. So now both of you have had an opportunity to work with many pharmacies seeking and achieving the rare disease certification. What tips do you have for pharmacies that are getting ready to pursue this certification?
I can go if you.
Yeah, go ahead.
I
Sure,
think
go for it.
the key thing that I see is just to be committed as an organization. Rare disease is not something you can do as a side business. Yes, we're tied to our specialty, but it's much more than that. And you need to be committed to this population. They have very unique needs that don't fall within that traditional pharmacy model. We're very data driven. Sometimes, as like we talk about journeys, sometimes this may be a free text where you're having a conversation. So just be aware that there are different needs if you're going to be in the rare disease population, and just build those relationships everywhere. Manufacturer, support groups. I think that's key, is just get involved.
Yeah, I agree. And I think it's really important to understand that the rare disease certification is not simply specialty pharmacy applied to rare diseases or applied to orphan drugs. Like Bruce talked about, it's a different patient population. There's different needs. You certainly need to be a very good specialty pharmacy, and then that will help you to grow into a good rare disease pharmacy. But there's requirements that are above and beyond what's needed to demonstrate that you're a specialty pharmacy, or at least an accredited specialty pharmacy. And I think that starts with reading the guide. That's a great tip for everybody, right? Read the rare disease certification guide, see what's in there. There's some good information, interpretive information that helps to understand the standards, and certainly your pharmacy reviewer can work with you to help make sure that you've got a good understanding of interpretation of what the standards are asking for. And then leverage the resources you have. If you have already a strong clinical team, use that clinical team to make those connections with the manufacturer, to be able to understand that disease and those unique challenges that it presents. And I think starting there is a great way to begin that process of working towards being able to be a rare disease pharmacy.
Yeah. No, thank you both. And I think, from the work that I've done with both of you as you've reviewed organizations as well, it's interesting because the rare disease standards, right, they're specific in they will address the patient journey, the additional education, different patient reported outcomes need to be considered, right? So there are definitely new concepts that elevate the level of care that are provided. And because of the specificity of each rare disease, and the individual therapies for each of those rare diseases. It's almost like you have a mini program for each one. And so I think sometimes organizations have struggled a little bit to think holistically about their rare disease practice because each disease state, each orphan drug is going to kind of be its own mini program. That's fine. That's fine. But it is making sure that for each of the rare diseases that you're treating, all of those elements are being addressed. And sometimes I think that's a little, just it takes a little bit to wrap for the organization, particularly the organization that is launching a new a new rare disease practice to get there. And we've definitely seen the organizations get there. So. Excellent. Excellent. So I just want to take a look in the chat and see if we have any questions that have come in for us, because we're happy to wrap up doing that. I do see a few questions just about, are there resources that will list the different rare diseases that are out there? Again, we have gone to the NORD website that has a lot of information about specific diseases as well as databases there to take a look at that. Certainly, you can go to the FDA to understand what specific drugs are have been offered the orphan designation. You can learn a little bit more about it that way. Any other questions? Let me take a quick look at the chat. I don't know that I do. If you are a specialty pharmacy or with a specialty pharmacy and you have a rare disease practice, or that's something that you're thinking about and you're interested in pursuing the rare disease certification, certainly please, you can reach out at that email address right there, businessdevelopment@urac.org. We have folks that can help you start that journey. One other thing that I'll mention, rare disease is certainly a focus of ours here at URAC. It's something that we are very passionate about. I can also share that at the upcoming Assembia Summit that will happen in the end of April, beginning of May, URAC will have a session there as well, where our president and CEO, Dr. Sean Griffin, is going to be hosting a panel of some of the organizations that have achieved URAC's rare disease certification. Well, they will be talking firsthand about their different practices and their journey to becoming rare disease certified. So if this is a topic that you're interested in, we would certainly be very happy if you would join us at that session as well. Thank you all so much. Thank you, Joe. Thank you, Bruce. Hope everybody has a great rest of their day.